Right, GBMC infection control practitioner Molly Hyde joins us back in the studio as we are taking your questions. Everybody's concerned about the coronavirus. You know, Molly, I have a daughter, and she says, "Oh, Mom, you don't have to worry about the coronavirus. That's only for old people." Well, I'm not too far from that age group. Do children have to worry about it?
So studies have shown that children definitely get less severe disease than older adults. So the older you are, the more severe disease you get. We aren't quite sure if children are less likely to get infected than older adults, or if they're just getting infected and we're not even noticing that they're sick because their symptoms are so mild. So it's really hard to tell, but we do know that at least they are not getting as severe disease as older adults.
And that was the next question I was asked. Are their symptoms different?
So their symptoms can be slightly different. In all cases, both children and adults, you are seeing kind of the same respiratory symptoms like fever or cough. In children, you also do sometimes see nausea and vomiting, as well as diarrhea sometimes in children. And that actually tracks well with the flu. We see that with children with the flu as well, where we don't see that with the flu in adults.
And we're usually most concerned about the babies, in terms of them being immune compromised. Everybody's using hand sanitizer. Is that safe for babies? Infants? I say toddlers maybe?
Yeah, so you really want to be careful about putting sanitizer on your kids. For toddlers and young kids, you want to do it with supervision. So really the concern is them getting it on their hands and then putting their hands in their mouth, which we all know kids put hands in their mouth all the time. It's not necessarily dangerous for their skin, but you do want to make sure you're not letting them put their hands in their mouth while the sanitizer is still wet on their hands. And keep in mind, good old-fashioned soap and water works just as well as hand sanitizer.
Okay, so everybody's probably going stir crazy at this point. Kids not in school. Yes. Is it safe for them to play outside?
Yeah, so they can play outside. You really want to just limit the number of kids that are playing together. So, if your kids want to play in the yard, if you've got a swing set in your backyard, that is absolutely fine. If your kid wants to ride their bike up and down the street, same thing. What you don't want is, the whole neighborhood gathering all taking a walk together. But if you're practicing your social distancing, it is safe to go outside and take a stroll or play in your yard.
I would think, given that mindset, you probably want to stay away from a public playground.
That is correct. Yeah, you really don't want to be gathering at public playgrounds and gathering in large groups.
So my daughter has asthma. A lot of kids have asthma. Are they at an increased risk? Is that considered, immune compromised?
So it could be. It's not really clear at this point whether people with asthma are at a higher risk for severe disease. We know serious comorbidities like heart disease and diabetes can put people at higher risk for severe disease. Asthma, we're a little less clear on, but you do want to be careful if you do have any underlying medical conditions, including asthma.
So the most important way to keep your kids safe?
Most important way to keep your kids safe is teach them good hand hygiene. Clean your hands.
20 seconds, 30 seconds.
20 seconds. You can sing Baby Shark. You can sing Happy Birthday twice. There's all kinds of good ways to make sure you're washing your hands for the required 20 seconds.
All right, Molly Hyde, thank you very much. Again, these are our experts right next door taking your calls. The number to call right there on your screen for you, 410-671-0702.